Good morning, everybody. My name is Pamela Vergara-Rodriguez. I am a physician in internal medicine, psychiatry, and addiction medicine at Cook County Hospital, and I oversee the psychiatric services at Ruth M. Rothstein Core Center. It's my pleasure this morning to have our three panelists here with us today, and I'm going to go ahead and share my screen. If I would ask for permission to share my screen. We have three very special people here with us today, representing three really collaborative organizations who have given so much to our Latino community within Chicago and working on suburban Chicago as well. We have Marco Jacome from Healthcare Alternative Systems. We have Eddy Borrayo from, the Rincon Family Services. Here we go. Let me go ahead and share. Okay. And finally, we have Paul Naranjo, who will be on shortly. I still can't share Aida, but that's okay. For some reason, it's just not let. Oh, here we go. Here we go. Thank you. And Paul Naranjo from
Nayeli,
just one second.
Naranjo, he's not showing up.
Okay, wonderful. Here we are. Let me go ahead and share my screen now. From Pilsen Wellness Center. So I know we're having so many technical difficulties, and thank you to all of you who have been so patient. This morning, we're going to talk about probably one of the most important topics we can possibly discuss, which is the topic of mental health and substance use disorders in our Latino community. We all know that services for our community that are language and culturally appropriate and accessible have not been readily available. And we have three people with us today who have done tremendous work in advancing access to care. And so I welcome all three of them to talk with us today about the work that they're doing and how this has impacted us now in the COVID-19 pandemic, as well as elements that we're facing now in terms of health disparities. Aida, I would ask for you to mute. So I will actually go ahead and get started. Here are our lovely panelists, and you can read full bios of each of them forthcoming on our speakers view, but just for you to get a sense of who our guests are today. Marco Jacome has been at Healthcare Alternative Systems, the Chief Executive Officer since 1992, has done so much work on not just a state level, a federal level, but most importantly in our community areas, offering services, expanding services, and even expanding services outside of Chicago. So thank you, welcome, Marco, and I'll let you get started. Please let me know when to advance the slide.
Sure, thank you. Great. I want to thank the opportunity to have a little presentation. 15 minutes is not much. So I'm going to talk a little bit in terms of the statistics and where we are in terms of the use and abuse of substance abuse and also the mental health. But also later on, I'm going to talk about social determinants of health in our community. So if you can just move into the next slide, I really appreciate it. I'm going to try to go a little fast. I also have some statistics in terms of opioid epidemic that I'm not touch much because I think Eddy is going to be talking about it. So I'll briefly just mention a couple of it, and then I'll jump into the terms of health. So it's just for you information, the magnitude of the problem that we have right now in our community. You can see in 2 out of 5 people have struggled with illicit drugs. 3 out of 4 people have struggled with alcohol use, and 1 out of 8 people have struggled with illicit drugs and alcohol, which is both the co-occurring. Also talking about the mental health, we have a major problem, especially, I would like to see if you have some opportunity to talk about this 2020, because the statistics that right now are the last 4 years, 16, 17, 18, and 19, and the 2020 with the pandemic has definitely increased our need of services of mental health and substance abuse. So the magnitude of the problem is just getting bigger and bigger. Could you move to the next slide, please? So just to give you a perspective in terms of the age range of our problems, and if you can see from 2016 to 2019, in all ages from 12 to 17, 18, 25, and then 26 and older, has maintained the same level of problems that we have in our community. Next slide, please. So just, this is a statistic in terms of 2019 about the significant increase, from 2018 to 2019 about alcohol and substance abuse. And then, the rest of the issues of alcohol and drugs have been maintained the same, but it'll be interesting to see what is going to happen with the statistics and the 2020 with the pandemic occurs, and it has a significant increase of overdose and the opioid epidemic, overdose and issues of mental health, and also in the use of substance abuse. We are seeing already in our facilities the increase of mental health and substance abuse in the Hispanic population. Could you just move to the next slide, please? So here's the illicit drugs among the Hispanics. What is it? The drug of choice, if you want to say it. And then, of course, marijuana is a significant increase. It will be interesting also, again, with the legalization of marijuana, how the percentage, if you continue, increase there. The psychotropic medications, of course, this is the big issue right now, illicit and also being given by doctors and prescriptions and over abusing that. Hallucinants and cocaine, inhalants, and methamphetamines are probably the last, and heroin. It shows this very minimal, but when I have in a slide, you can see how heroin and also plays the prescription medications with pain relief that they are being overused. So could you just move to the next slide, please? So here's I don't want to take the presentation of Eddy. I didn't see it, but it's just going to give you the magnitude in terms of the problems that we have in opioid use in our communities. The overdose, I just got some statistics in the Department of Public Health, and has increased the overdose and the use of opioids and medication, prescribed medication by doctors. Could you please move to the other side? And here's again, in terms of age differences, in terms of what you see people start using opioids as early as 12 years old. The biggest concentration in our community is from 18 to 25, and then you can 26 and older about the use of opioids. Next, please. The prescription medication, of course, this is what makes the differences in terms of like Oxycontin, people being using and other prescription medications that either they acquire either by the doctor prescribing for pain medication, also taking from parents and families, and you can see a chart that I have where it comes from. So could you move to the next, please? Next slide. So here's it's interesting. If you want to say graphic in terms how do you get this opioid issue, in the pain medication reliefs among the Hispanic population. 37% of people prescribed by the physicians, and then the time they abuse. Other about 33% of people are getting from friends or relatives stealing the opioids for their use and abuse. It's very interesting slide. I would like to move into the next one, so just give you a perspective of what kind of prescription drugs are being used in the Hispanic population. Of course, Oxycontin, codeine are the major use and abuse in the Hispanic community. After that, Oxycontin and morphine, which probably prescription is used for pain relief in the hospitals, but people also continue abusing that. Could you move to the next slide? So here's a little bit in terms of, yesterday Dr. Riacello did talk about it, it's interesting about it. The process of acculturation in our Hispanic community. People are becoming, they're healthier in their communities or their countries, but when they come and get acculturation to the Hispanic, to here in the United States, their lifestyles get worse. So also yesterday, Dr. Giacello in the presentation talked about the values and the beliefs that we have that are so good in our community that we should continue embrace that, like familiarismo, confianza, simpatía, respeto, personalismo, espiritualismo, very religious community, orgullo. The machismo and marianismo that Dr. Giacello talked about a little bit in terms of, a lot of people think that the machismo is seen the negative connotation, but as Dr. Giacello explained to us, this is a great attribute and asset to the community. The male, particularly the male, because is the person who takes care of the family, protects the family in all levels of, so that our families be, protective and being fed and good workers and all that. So can you move to the next slide, please? What are the social determinants of health? Usually the social determinants of health was primarily created or addressed the physical health. And then later, we have seen that also, the social determinant of health also plays a major role in the emotional of our society, in the mental health. Could you move to the next? So here is the social determinant of health, of course, physical environment, economic, health systems, community and social context, and education. All the presenters have been talking about these issues, how to, those components, 4 components, 5 components are part of the social determinants of health. How do we address, if you can move to the next slide, please. Of course, and then the economic influence of that. Our community suffers, for lack of jobs, lack of well-paying jobs. So that can, create a detrimental in your social determinants of health. They cannot have afford a good housing opportunity because, the conditions of the economic. In the health systems, of course, one of the greatest things that could happen, at least from my perspective, was the Affordable Care Act. That everybody, at least 90 to 95% population got covered with health issues. The problem that we have with the Affordable Care Act is access. There's not enough doctors, not enough clinics where the kids and the families can access the services. Could you move to the next slide, please? And then, the physical environment, right? It plays a major role in terms of the physical environment, which is a sort of one environment that could influence the health. Education, major role in our community, right? We still have issues with our education for kids. Just think about it. What is going to happen with the pandemic that occurred, that the kids couldn't go to attend school? Our parents cannot do a tutorial education in our schools because they work. They don't have the knowledge to teach that because, again, most of our community are not highly educated, so they cannot keep up with the education here to teach the kids. So I believe that, we have lost a whole year of education for our kids, and how are we going to be addressing in the future? That's going to be a major problem because they're already behind. We did talk about, in the past, the issue of not be even if it was, the telehealth, teleeducation, kids didn't have access to internet so they can be educated, or they have one internet, one computer for 4 kids. How do you can get a class in there? And then the community and social context, right? Healthy social groups and social support systems, so important in terms of having and living in good communities where, you know, especially for our kids with, you know, the challenge for us that our communities are being poor, lack of access to many things. You know, some of our places are deserts of food, where they can access, you know, food, and the issues in terms of also access to doctors and the mental health component that is priority. Important factors to consider is, you know, of course, you can just move into that. The next one important factors considered is demographic variables. Language is so important, you know. All the 3 centers that we are presenting here have bilingual services, a tremendous help for our families. Opportunities to enter treatment, right? Access and retention, which is the most important thing in the behavioral health. A lot of people in our community don't know where to access services. And this is what, you know, with prevention and education in our communities, and I think Paul's gonna be talking about that we need to do a better job to educate our families how to access our services. Not only our services, better education, better jobs, better health systems, better housing, everything. When a person comes to our clinics, it's not a single problem that we have. It's not a problem of drugs or mental health. We have multiple problems as the social determinants of health: housing, education, you know, primary health access, as mentioned before, behavioral health, you know, elderly parents, and lack of resources. Unemployment, you know, big issue right now, you know, in our communities, because the COVID pandemic has totally affected, and then probably we're gonna see the impact in this year in terms of the consequences that the pandemic has occurred. We're the highest you know, community affected for the pandemic. Latino Institute just released a study in terms of, you know, Belmont and Crans had one of the highest concentration of COVID in our communities, and in all the neighborhoods too in our community. So we've been incredibly affected for the pandemic. Next, please. Some recommendations to act, right? Of course, there are many ways agencies are working to address these issues of social determinants of health. You know, we need to continue evaluating in our communities, you know, as mentioned before, affordable education, preschool, food banks. One of the problems that I see sometimes is in the food banks. You know, for example, we talk about our families, the nutrition, but when they go to the food banks, they don't get the appropriate food, nutrition food, and they get a lot of carbohydrates. They get a lot of junk food that is contraproducent in terms of our teachings about, you know, good manners of food or taking care of yourself, and in terms of you know, nutrition. Develop and maintain community resources list. I think that, you know, as mentioned before, one of the problems that we have in our communities is to have access to care. They don't know, our communities, where to go and get help. Sometimes because language barrier, sometimes just lack of knowledge. Mentioned about food before, you know, housing, security, housing, transportation is a problem. Sometimes clients or families cannot access treatment because they don't have transportation. And the creation of partnership. I think that, you know, the more I learn, I think that one organization cannot do all. I think the collaboration and support of each other is important for the benefit of our community. And I think that we should continue doing that. You know, you mentioned, Doctor, the relationship that you have with our centers in terms of referrals, and then also we'll have vice versa. Do the people need some medical services? You know, how do we connect? So we need to do a better job there. And then, you know, in terms of our agencies that also addressing the determinants of health, we will continue making, understanding our community, right? You know, understanding first, second, and third generations that we have. I think someone in the other presentations talk about, the lack of research in our Hispanic community, especially in the behavioral health. I think in other areas in primary health has been done. We have advanced a little bit, but it's so much to have a good research in terms of addressing the issues of behavioral health, what works for us, what doesn't work for us. Literally in our organization, we use cognitive behavioral therapy is one of the most the best approaches that we have to address that. But also, I think we need more studies to address, to understand our community, to understand and create a better models of treatment for our community. What else? To ensure that our clients are preferred, language is so important, of course. Continue explore ways in which we can affect and deliver it and provide a better delivery services in the Latinx community. I mentioned, continuing implementing effective methods of treatment so that our community can benefit. And that would be my 15 minutes presentation. I'm sorry that went too fast. Are you mute, doctor?
And now, thank you so much, Marco, Jacome. Thank you for all of your insight. And we'll definitely get back when we have our question and answer panels. Next, we're going to be having Eddy Borrayo, who's president and CEO of Rincon Family Services. And he's going to be focusing his discussion on opioid use. So much going on, obviously, in this last year. So I will just let him go ahead and get started. Thank you, Eddy.
Well, thank you, everyone. Marcos, thank you so much for opening up this panel of a very important topic. Again, my name is Eddy Borrayo. I'm the president and CEO for Rincon Family Services. We're going to talk about the opioid crisis. This is something that we hear in the news every day. It's like, what really is happening with the opioid crisis? And the interesting thing is this crisis has been going on for over 50 years. Rincon was established in 1972 to address this exact same problem, to address the opioid crisis. Doctor, we could do the next slide. But the problem has been this. In the last 10, 15 years, it has evolved from being a problem within the inner city into being a national problem. And very simple, prescription drugs. Prescription medication has really amplified this problem. What is an opiate? First thing when we think about an opiate or something, we think about heroin. And everything is derived with the poppy plant. An opiate, like here that we see, it's a medication. It's a type of narcotic pain medication that binds receptors in the brain and spinal cord, and pretty much it tells the body that there is no pain. Very good concepts for medicine, but we have issues. Doctor, can you, next slide? So the problem is that it is creating a major issue in the US, and Latinos are not exempt. We have been, like Marcos talked about, 1.7 million prescriptions that has caused issues within our community. The leading cause of death is between people under 50 years old. Just think about 91 people dying every day of an overdose. Marco hit on a lot of the concepts I was going to talk about. So I want to focus more like, what can we do as an educated community, empowered community leaders to reduce this number? But it's not only the issues with the overdose, it is also the black market that is caused by opiate use with the selling of heroin. About 11,000 people have died just because of that. And then the introduction of fentanyl, which has really skyrocketed the overdoses. The next slide, doctor. So what do we see? Sorry about this little typos there, but I want to put into perspective how big the problem is. And I put in here major milestones of fatalities on different things. In 2016, we saw the highest rate of overdose of substances, 64,000, about 176 per day. If we look at the next one, 1972, we had car accidents, 54,000. HIV in 95, 50,000, 51,000. So you see these major things, but why is this such a problem? The next one, doctor. There is major problems in next slide, doc. Um, on the issues of the epidemic, limited services, number of available services within the community, but there is other things that we lack. It's really educating ourselves. It is a big issue, but the good thing is there is now an investment coming down from the feds, and it's been coming up, and I want to commend our governor and the leadership at Super, and where they provided a lot of education, a lot of opportunities to get out the word. With the release of naloxone, and this is a medication that is used to do reversal of an opiate overdose. This is something that anybody in the state of Illinois, you just go to Walgreens and say, can I get a kit of naloxone? And it's very simple to use. Real quick story, just to tell you that anybody could do it. We have a medication assisted clinic, and we train all of our staff, including the receptionist, on how to use the naloxone, which is a nasal administration. This person got trained on a Saturday because it was a weekend training. And then on a Monday, on the way of closing the office and going to his car, he saw somebody that was overdosing on opiates. This person automatically took on their naloxone kit, administered, called 911, and that person was saved. This is what we want to do, and I commend the agenda of putting this panel together. Education. I think the biggest thing that we could draw out of any of the presentation is what can we get to empower the community? One life loss is one too many, especially with our young people within our community. But here, what do? We see again, is this number. Next slide, doctor. The numbers just speak by itself. Look at the age demographic and the sex. The majority of the people that are overdosing are males. And if we look at the age brackets, they're the young people from ages 20 to 49. But even if we look at the 19, those outliners, where do we go? And I'm glad that Paul, which I've known for many, many years, is going to talk about prevention. We have to work at this concept of educating, of treatment, and community engagement from all aspects. Nobody is excluded. This is where, as young as Marco talked about, 12, and even our senior citizens, prescription medication. And when I used to be a counselor, I used to tell the community members, especially loved ones, what do you have? Checking your medicine drawer or your medicine cabinet. What do you have? A lot of the experimentation happens at grandma's cabinet or even at our cabinet. The doctors prescribe pain medication. They prescribe anxiolytics, benzodiazepines. And if it's not taken properly, then people could develop an addiction. Next slide. But if we know the signs, and we get educated, similar to what I shared with this story, if we see somebody and we have the knowledge and we have the tools, and in this state, again, go to Walgreens, you ask for the naloxone, you're able to get it. Quick training, and you'll be able to save. Simple things such as this, looking and knowing the signs of an overdose. But what do we do after we help these individuals? And this is where we educate them about the resources that are in the community. Both Pilsen, Healthcare Alternative System, Rincon Family Services, and our affiliate in Kankakee, Illinois, Duane Behavioral Health. These are all medication-assisted facilities that have wraparound, holistic, and comprehensive behavioral health. There is no magic bullet. Similar to what we saw at the beginning where we had that hiccup between the presentation, something does go wrong. But what do? How do we jump back? And how do we educate not only the clients, potential clients, but the community as a whole, that this recovery process, it's a lifelong process, and where there will be mistakes, but there will be organizations, there's going to be community leaders, there's going to be doctors like La Doctora Pamela, that are there, ready to help you move forward. Next slide. But we need to know step by step. If we know there's an overdose, calling 911, providing supporting breathing, administering the naloxone, all this, very simple. Let's call 833 to find help. You'll be able to get linked up not only to a provider, but also to individuals that did anything, any substances, both at residential or even prevention, they'll be able to provide you services. But let's learn the myths, let's learn the facts, and this is part of the educational process. The next one, Doctor. But substance abuse is not in a vacuum, and Marcos homed on this. There is also underlying issues, not only with health, but also mental health. About 10% of everybody that's prescribed an opiate develops some type of depression. There's pre-existing conditions. And sometimes if it's not processed or talked about or educated, these individuals don't know what's going and what's happening. And what happens is they go back to what the things that they know best. It's either feeling depressed or using a substance. And then we start that vicious cycle. Educating the community is also important to really remove that stigma that creates isolation, that we start creating a community of recovery, of support, that we educate individuals to become peer mentors, supporters, providing them either mental health first aid or education on just substance use. So we could start breaking that barrier, that wall of stigma that has plagued our communities. Next one. And this goes with the basic education. Sometimes when we talk about harm reduction, we talked about meeting the client where they're at and not judging them. And sometimes that means, like, if you're using heroin, can you use it safely? Can you use it not by yourself? Again, we want to save that life, because if we lose that life, we cannot save that life. So it's really seeing it from that perspective. But it all starts with, who is our client? Are we talking to them in their language that is adequately? Do we provide the services in that culturally holistic environment? So we'll be able to reduce and break that stigma and really create that recovery orientation. Next slide. But this is a wraparound services. It really, again, the three organizations that are represented here, we are the largest and oldest Latino providers in the state, and I would say, yeah, in the state. But coming together and helping, there is no one agency that could provide these services, but together as a community, as leaders, providing education through forums such as this. Again, the agenda is doing a wonderful job on this, and we're proud partners. How do we continue building upon the blocks that our elders has created? We will have a vacuum in leadership and in service deliveries, because this is a very tough and hard field. But we need to make the next generation not only build upon what we've done, but also continue breaking that stigma, continue working in collaborations so we could have the next generation of providers, next slide, that will be able to break that resiliency. I always like ending on this slide because it really puts it into perspective, how severe the problem is. At the top, we have one individual, one fatality of an overdose. And again, this is at the apex of the numbers with the overdose in 2015 towards 2016. For every person that has died, there are 18 individuals that are using substances, heroin. But look at the bottom. For every person that's died, there's almost 3,000 individuals that has used a prescription opiate in the past year. The numbers speak for itself on the problem that all communities, and if we look at specifically how it will impact the Latino community, equity is a big word that we talk about. There is no equity in funding. There is no equity in resources. That is why community collaboration, empowerment, And creating this community of recovery is more important now than ever, because it is very difficult working with a family and then having that family come back to you saying, this person was released from a hospital and they overdosed and they died, or even more tragically, when they're released from jail and literally hours, if not a couple of days after, they overdose because they did not have Vivitrol or another medication because there was not a prescriber ready to administer. These are the challenges. These are the opportunities together as a community we need to address, we need to confront, and we need to create solutions that are long-lasting solutions. Next slide. My information, I am at your service. Likewise with my colleagues, we're here to provide services together. Thank you.
Thank you so much, Eddy Borrayo from El Rincon Family Services. And I just want to touch on the point of what Eddy just mentioned, that we are really honored to have 3 of the largest Hispanic service providers. These are the 3 healthcare alternative systems, El Rincon Family Services and Pilsen Wellness Center. And we will definitely get back to having a discussion with all 3 of these wonderful leaders. And now I'd like to introduce Paul Naranjo. He is Director of Early Intervention Services. We know how important that is, and Special Liaison for Legislative Affairs, providing expertise in risk reduction, violence interventions, and expanding substance use services for youth. Thank you so much, Paul. I'll let you get started.
Thank you so much, and it's an honor to be here with all of you, especially with 2 community leaders, Eddy, Marco. Thank you so much for considering me to be a part of your team for this effort. I would like to start, first of all, connecting. I mean, of course, mental health, substance use, prevention, and all of this is part of the same cycle, behavioral health. So we would like to first, go back and talk about the COVID-19 pandemic and how it has continued to change the perspectives on how we're interacting with one another. This conference is proof of it. For instance, today, in which we continue to work with our teams in the way in which we are creatively coming up with new solutions, making special accommodations necessary to for the delivery of services for the communities that we work with. New strategies continue to evolve, new technologies, in the way to overcome the struggles that are faced by our families, by our community in these challenging times. As we continue to accept the new ways of doing things, the existing systems of care that we have available are tested on their ability to be flexible, to expand, and to meet the needs of those families under this new reality. As we continue to find our way in the midst of our uncertainty that has been caused by a global crisis, our prevention, treatment, and recovery services have not always been able to meet the needs of the communities, especially those of color, which, according to the Substance Use and Mental Health Administration, SAMHSA, have been disproportionately affected by the current crisis and haven't been able to meet their needs because they have been becoming inaccessible to them. The use of different restrictions at the different levels of government, which have been established to prevent the spread of COVID-19, which has served, of course, the public interest as ways to protect the public health, has also had a negative impact on minority groups who, as a result of such restrictions, having had limited access to the responsive social services that they need and have lost that sense of control, self-care in the midst of an uncertainty that we're facing. Hispanics in the US, according to SAMHSA, tend to be more likely than the general population to see COVID-19 as a major threat to their health, their finances. And this fear is not just in the minds of our community. According to the US Department of Labor, 8.8% of Hispanics ages 16 and up continue to be unemployed. That compared to 5.9% for the white population. Unfortunately, this percentage is even higher for African Americans, whose unemployment rates were at 10% as of January 1st of this year. Based on these facts, we can support the assertion that communities of color have been and are disproportionately affected by the current crisis, and they don't have the resources that they need. There are multiple challenges that continue to be faced in our communities, such as inhumane immigration measures that take place, putting vulnerable children in cages, the fear of deportation of millions of individuals who are parents, who are friends, who are relatives of many of us. Issues related to systemic racism in our communities, street violence, which continues to be an issue in large cities like Chicago. According to the Chicago Police Department data, between 1999 and 2004, 3,422 individuals lost their lives as a result of gang-motivated events. Gang activity is a big problem. Just from March 21st through the 28th of this past month, crime continues to be an unresolved issue in our communities, where 767 incidents took place in just 7 days, to include murder, sexual assault, robbery, theft, both personal and motor vehicle. This number increased from 580 in the previous year for the same period to 767. Another issue that we face as a community is the pervasive wage gap that exists. According to the National Partnership for Women and Families, Latinas are paid only 55 cents for every dollar paid to white men, what will equal to an annual salary difference of $29,029 because of gender, perhaps because of race. The point is that we can do better as a nation, and the list can go on and on. And we can change this reality with providers like healthcare alternative systems, like Rincon Family Services, and like the organization I work for, the Pilsen Wellness Center. And like us, many other comprehensive service providers that can help us to overcome the challenges that we continue to face as a community that is meant to care because of our heritage as Latinos, as minority groups, without leaving aside the benefits that can come from individualism and the spirit of competition that can come with it. As a member of that community, I believe that this is an opportunity for all of us, a wake-up call, to change our mindset, the way in which we approach things, in which we develop the services that we're delivering to the community, to ensure that the services that we start to provide moving forward are tailored to the needs of our families, and not to assume that the models that are provided to us do fit our community, because one size does not fit all. To develop a spirit of collaboration between organizations is rather of that of competition, in which mutual care, the concern for the community, can help us overcome together the common challenges that we face. In this case, coronavirus provides us with an opportunity, not just to protect ourselves and our families and those people that we care for, but also to unite ourselves so that we can together come up with new strategies to better serve those individuals that we call our own. Prevention is also a key part of this presentation, as it has to do with our ability to act proactively and not reactively to the issues which we are confronted with today. We want to make sure that we can translate not simply in healthier and safer communities, but also on increased savings for our taxpayers. Those that can be used to create and support protective factors such as parks, recreational programs, infrastructure, that will allow all individuals a fair sharing and opportunity for success. Prevention and treatment go hand in hand, as we cannot neglect all individuals that have been affected by mental illnesses and addictions, considering the fact that addictions do develop over time and there are other factors that contribute to mental illnesses. As professionals working in the field of social services and based on my managerial experience here at the organization, I believe it is important to educate parents, stakeholders, community leaders, youth in our community on ways that are alternative to effectively and openly communicate as a community, to find new alternatives to better support our children on the issues that are currently affecting them. We have a need for the adoption of new strategies of collaboration to improve our services through a private and public initiative that could work together in our communities for the development of new social service opportunities, such as the formation of parent leadership groups, mentors, tutoring, arts and crafts, and other services that can promote healthy behaviors among our youth as a way to ensure that they are provided with the tools that they need to have a sustained emotional well-being. There is like such a variety of complex issues affecting today our youth, and the trend continues to increase on issues such as depression, suicide, anxiety, feelings of isolation. As a community, we need to invest more on our youth by creating partnerships for the creation of job employment opportunities, job readiness programs, and accessible and affordable college education, not just for youth, but also for adults. Additional support can be provided to promote the development of our youth that includes violence and substance use prevention, after-school activities, parenting strategies and education, among other services that combine with the development of new evidence-based model curriculums that are tailored, of course, to the reality of our community. We can hopefully better address the risky behaviors that are causing so much suffering in our community, in our families, in today's society. I feel honored again to be able to be a part of this workshop with leaders like Eddy, like Marco, like you, Doctor. Thank you so much for inviting me to be a part of this conference. We can continue to promote the health of our families by investing more in the prevention of risky behaviors, by creating new family and community support systems that better address the lives of our children through our education, research, and actual policy. I invite you, all of you, today to continue to work together to rebuild our communities. It is possible. As promoting the well-being of our youth and families is a responsibility that we share as a society. They are not the future. They are our present. Thank you so much. And also I did provide some information regarding the benefits that prevention does have in dollars and savings and all of those things that have been touched beforehand. Thanks.
Thank you so much, Paul. And I just want to please, if you are able to put in your questions, but if not, I definitely have, and I'm going to stop sharing this at this point. So many important issues were brought up during this panel, and I want to just review and hear from our panelists their specific suggestions. As Paul has mentioned, the COVID-19 pandemic has really demonstrated the difficulties, the social, the economic struggles that our families have been going through with job insecurity, also with the children. Marco mentioned, how can we do education at home with one computer for 4 children? How is that even possible? In essence, this year has been a series of challenges. And of course, as a result, with the connection of mental health and substance use, that people in distress will then potentially turn to substance use or have worsened symptoms of mental health. So I would love to hear from each of our panelists, from their point of view during this pandemic, because of course, we will refer all of our patients, everyone here on the call, everyone today will know and will reach out to refer those who they can to the organizations that we know are trusted community members. And so what advice can you give to our audience today about, and from each of you, because you focus on different areas, maybe Paul, we can start with you first, focusing on children and violence reduction and what we can do to focus. You mentioned job creation, you mentioned focusing on education. For you, even though we can get children into services, what can we be doing in our homes and with our families, in our communities to build up this structure, like Marco said, build up a physical environment, this social structure that needs to hold our children now that they're having such difficulty with this year of missing school. So many people have this question.
Yes, I believe, like that it is important, as I was suggesting beforehand, to have all the key stakeholders in the community working together in order to overcome the issues that are affecting our youth, such as local law enforcement, elected officials, businesses, community coalitions, of course, public funding and funders, and then school teachers, even the youth, because like you cannot talk about the with expertise about an issue that doesn't affect you. Like you also have, it's important not just to understand, but also to live through that. And I think like all of us, we have been young at some point, and we know the struggles, what it takes as we evolve into young adults. In the sense, in the sense when we are trying to define our identity, where we're trying actually to explore. And that is part of why youth are being involved in risky behaviors. Then we can come up with evidence-based strategies through research, through focus groups, etc., that can be developed to maintain the well-being of the youth in our communities. Because as of now, there are like over 100 evidence-based model curriculums that have been accepted and proven to work for across different populations. But I haven't seen, like a curriculum that is tailored, let's say, here in Chicago for youth who live in Little Village and Pilsen and Gage Park and all of those communities. So that's what I was referring to with one size does fit all. That is not the case always. Like the reality continues to change. So what worked yesterday doesn't mean that it's working today because of the issues that are affecting us in our families.
Exactly. And we're going to need the creativity and the leadership from all of you to be able to develop programs that will help kids get back to school and get back into an education focus rather than falling into violence or other risky behaviors that ultimately lead to both substance use disorders and mental health problems. So now I want to turn to Eddy and Marco, because you guys have both given us an excellent background of the current problems related to substance use. And Eddy, you talked about harm reduction. And I have to say firsthand that naloxone, as you mentioned, being able to save a life, right? An opiate, a potential person overdosing on opiates. And I've asked so many of my patients and their families, will you take this? Can you, and they say, no, I don't need it. Can you talk a little bit about how we can overcome this stigma of helping others being able to take on harm reduction strategies? What can we do in our homes and with our families and friends to overcome this stigma?
Great question, Doctor. I think one of the biggest things that we need to do is have individuals in the community that are trusted voices, and they become your ambassadors. These community ambassadors will be the ones that'll provide the information, firsthand knowledge and experience. And this is where we create these peer mentors and we deploy them at the churches or the food pantries or other organizations. But we have to also start training other community stakeholders. Specifically, we look at who are the influencers in the community. It could be your pastor, it could be a priest, it could be la madrina that everybody knows. These are the individuals that we need to get into our side for them to understand that harm reduction is part of this recovery process where individuals are going to go up and down like a roller coaster. But ultimately what we're trying to do is educating them to understand this pathology, this addiction that brings them to going back to using, and how treatment is part of that process. And even within this whole schema of treatment, we're educating our clinicians to look at the whole gamut. About 20 years, 25 years ago, now I'm dating myself, where we were in this phase where MAT services, medication-assisted treatment, was frowned upon a lot by clinicians, primarily the abstinence-based. And clients that were being administered medication that at that time was methadone, they were not seen as being in recovery. Now, as we start looking at medication, different options of medication with the onset of Suboxone, buprenorphine, and Vivitrol, we're seeing these new tools. And how do we deploy these tools? And everything, Doctora and all the panelists, as well as the people that are viewing us, it goes back to education. Where are we getting the information? Has that information been vetted? And how do we translate that information in a cultural and linguistic format?
Please mute.
Sometimes that happens in treatment as well. So it's like, how do we bounce back and get the information out and get the person out? So it's similar to what Paul was saying. There's no one silver bullet. There's not a one thing that fits all. But how do we create something that is ours? This is how we work in Chicago, or how do we work in Gage Park or Pilsen or Humboldt Park? And we become, then we're able to empower the community to rally behind that. Pero es la comunidad. La fuerza está en la comunidad.
Exacto, muy bien dicho. And Marco, I want to leave it with you. You have someone working in the behavioral health field now the last 30, 35 years, with all your vision, really pushing it forward. What is your vision of how you can see us? We've heard it, collaboration, networking. What is your vision of how to get us through to the next step past this pandemic?
Yeah, so it's interesting, right? We need to look at new models. Eddy is right. I when I went to school, we were so much abstinence based that, if you do it any other auxiliary, methadone, and now the medication, we just, you're not doing good treatment and things like that. And then we have evolved into medication is great right now. It's one of the great allies for treatment. You get your medication, you go to treatment, and that's that is the complete of a good, successful outcome for the individual and the families. One of the models that we need to start looking at, and we are practicing right now, like this, using the community health workers, using our own community to educate the peer support specialists. That is what we need to do. The approaches of harm reduction, and if they're not ready now, but who knows, in 1 year and 2 months, the person might be ready. We need to be able to give them alternatives. Someone said, not one treatment fits to all. So we have to be flexible. Now on models, in terms of, they don't come to you, but we go to them. And the community CTE, the community involvement approaches, that we go and look for the clients where they are, where they feel more comfortable. But I think in terms of goals, I think that, I'm the oldest person here, and maybe Bill Colombo will recognize me because she was my alderman many, many years ago. But I think that, couple things that we have to start doing is collaboration. We do have, they create a continuum of care. We have to, we don't have to do everything one agency, but collaboration. Creating resources for our community, creating alternatives where they can go, and the network and the relationship that we can take care. It's just saying, we need to, create a village for our future generation, and there's more collaboration, new research. Research has been lacking in our community, and listen, when I went to school, there was a few Hispanics graduating the school. Now I'm so proud to see doctors and lawyers and all that. So we do have the resources to create this opportunity to address in a specific study our community and what are the needs there. And researchers need to come in the community, need to work with us so that we can collaborate, because we're the trusted organization, right? We're the trusted public servant in our community with the linkage of that. But in your approaches that we're using right now is this peer support specialist, so that we train people who have suffering the conditions of drug addiction or mental health, and we put them back into the community with the training. And and then the community health workers with the work with the community to engage them and to, because they are the same, they trust, they live in the communities. I'm not saying that we don't, but they're more day-to-day operations. So my hope in the last couple of years is collaboration, education, empower. Our community has a lot of resilience, even though we have some negativism in terms of a lack of resources, as you mentioned, education, healthcare, financial, and all that. We have a lot of resources. We have, the mention that the values and traditions that we still ingrained in, and we have to teach to our kids too. It's good that they've become bicultural, bilingual, but also they know they need to know where they come from and be proud. And there are the future generations who are going to be, taking care of us as an elderly, but at the new people who are in need of help. So Eddy mentioned a little briefly, how difficult it is to find, clinicians for us to work, and people who look the same to us. This is a difficult time. The pandemic has created an immense gap of finding people in the field because they're burnout. We're all being affected. I myself being affected. Could you imagine, other people who don't have the resources or the resilience? They're being the mental health and substance abuse is going to increase this year. So we have to be ready for that. The problem is that we don't have enough resources in our community to address that.
Absolutely. So I want to say this very importantly. Before the pandemic, we never had enough substance use counselors, mental health counselors, therapists, psychiatry. We never had enough mental health services. There have been surveys done over and over again that demonstrate this. Now with the COVID-19 pandemic and the increases of stressors, the increase of substance use, as we showed throughout the pandemic, and the stress, the added stress of not going to school, the added stress of loss of income, the fear of the unknown, just the day-to-day not being able to plan and orient yourself, and it has become some disorganization on a day-to-day basis, is really leading to an increased need in services, right? So this is a call out to everyone on this call that we need to also foster and support the new generation coming up and support them through the next steps of getting through their education, because we need you. We need you. And if you're going for your next degree, we need you. We keep going. Don't stop. Don't let anything stop you. We have an important question here from Gustavo. How do you bring up an addiction problem to someone who is sensitive about it? And this is so important. So many of us have this question. We see someone with a problem. How do we approach someone in a way that they can hear us?
So a couple of things, and I'll let the rest of the people also talk, the panelists. But I think is a intervention, to create an intervention model for the family. We need to educate the family how they need to confront the individual about the issue, because one of the greatest taboo problems that they have addiction is denial. They don't see themselves they have a problem, right? Until the chronicity increases. So I think models of intervention, so to create an intervention, but the family needs to be educated first, how to approach that. I'll let Eddy.
The first step, education. Eddy, do you want to go?
Yeah, I want to just highlight what Marco says, educating first. You need to educate yourself on what the issue is at, but also meeting the person where they're at. What is the addiction a big issue there? And if it's not, then you could work with some of the low-lying fruits that you could work with, develop that trust, and then prompt. But everything starts with education and being able to be having your resources available. And this is where it's tricky, Pamela. And as a doctor, this is a big issue. If somebody wants treatment, they don't want it 30 days from now, 45 days from now because of the waiting list. They want it now, in this moment. They're ready now. And this is where, again, education, knowing where the resources, developing that plan of action. So when that person is ready, say, okay, you're ready, let's go. And I would bet that the majority of the people that are on this call has had either a loved one or a real close friend that suffered from addiction. And it is very hard, and it's very painful, and it is a life process. So it is really empowering, educating ourselves, being able to get ready for that life-changing journey and venture, because they will need us through that process.
Absolutely, absolutely. And I want to say something important that you mentioned, and I'll let Paul have the last word on this, but that the substance use oftentimes is a symptom of an unhealthy dynamic, whatever it is, right? And it could be a family dynamic, it could be a relationship dynamic, it could be an internal process. How many people have we seen who have lost their jobs and developed a substance use disorder? So losses, loss of self-esteem, and right now, losses during the COVID-19 pandemic, whether it's your job, family members, losses lead to that stress level that can sometimes use to misuse of substances, right? Paul, please go ahead.
Yeah, I would like to state, like that it is also important, and thank you so much, like for your expertise in the field. So, but I would like just, to state based on the experience that we have, again, yes, touching on Eddy's point, education is very important, but also having very, like open lines of communication, let's say with your children, since, prevention deals mostly with children, like, so having open lines of communication in a safe and trusting environment where they, like you talk to them about the consequences, but first you have to understand yourself and your fears and like and the harm that you think that the situation is causing you, so that you won't come, like, and basically like coming a negative way towards the child, but will come with a positive motivational approach to the situation, in which you can help the person, like talk about why is this person using it, what motivation, so you can understand maybe the problem is not as bad as you think it is, and then if understanding too that it will take more than one conversation, especially with children, but if the issue cannot be addressed, then service providers like the ones here in this panel can provide with the professional help towards the treatment, the recovery that they need, especially through early intervention in treatment services too.
Thank you, Paul. There was one more question about the services that are provided through healthcare alternative systems and Rincon Family Services and Pilsen Wellness Center. And the question was about wraparound services. And I just want to say, what are wraparound services? So wraparound services have to do with literally not just targeting the one problem that the person presents with, which could be substance use, it might be a mental health disorder, but also looking at it as a whole person, really having a holistic approach. Do they have food? Do they need job training? Do they need additional education? Is there potentially domestic violence in the home? And addressing the entire environment, the system of that person. And I personally have experienced wraparound services from each of these organizations, which again, I'm so thankful to have had. And I just want to make sure we had a request for each of the panelists to share their contact information. And again, it's Healthcare Alternative Systems, it's El Rincon Family Services and Pilsen Wellness Center. If you go on the internet, you will readily find that each of these organizations have multiple locations and many services. And we thank you, not just the summit, but the community, for all that you do and have brought for the community. And I now say to our community, you have heard them. Education, empowerment, addressing stigma, prevention, starting young, talking with children. We all now need to go out and do these things. This is a call to action. Each of us needs to be active in doing this. So again, thank you so much. I'm Pamela Vergara-Rodriguez. Please feel free to email any of us or the services, and we'll be happy to help you in any way we can.
Thank you, Doctor.
Gracias.
Thank you, Eddy. Thank you, Marco. Thank you so much. Thank you, everybody.
See you. Thank you.
Gracias.
Bye-bye. Great presentation, guys.
Thank you. Thank you so much. Likewise.